Hello everyone, I am Dr Chirag Chamria. I am an oral and maxillofacial surgeon. I practice in Mumbai. Friends, at Royal Dental Clinics, which is located in Mumbai, I have been practicing since the past 4 years. And in Royal Dental Clinics, we see a lot of cases about the age of 55, 65. It was just last week that we treated a patient who is 84 years old. What is the difference when I say that in this age group, an age group which is around 30, the elderly age group, it is called as the geriatric dentistry. Now what is the main difference in geriatric dentistry versus a young adult dentistry? In geriatric cases, we see that the patient not only has a dental problem but also has other comorbidities. Hence in these cases, we have to be very conservative yet give the patient a solution which they can maintain. So today we will discuss about a very common therapy which patients do take is an antiplatelet or an anticoagulant therapy. These patients are usually on blood thinners. These blood thinners are prescribed because most of these patients have undergone either a stent placement or an angiography or are at a higher risk of emboli formation. So friends, before we understand why do these patients take this kind of medication, we need to understand the need for these medications. So in case of any kind of an injury or any kind of an obstruction to a blood flow, this clotting mechanism, it gets activated. There are three basic phases we can divide this clotting mechanism into. The first is vasoconstriction, where there is an obstruction to the blood flow or where there is going to be an injury to the blood vessel, that area is going to constrict. The body is going to restrict the blood flow to that area. The second, the platelets in the blood, they are the type of cells, they will get activated and they form a plug. The third phase is where this plug matures and it forms a clot. And this process is called as coagulation. The first process of vasoconstriction takes around 20 minutes and the next process takes around an hour. So the whole process is around 1.5 to 2 hours. So what are antiplatelets? So antiplatelets are those group of medications which are going to affect the second phase, that is the activation of the platelets. These medications are like aspirin, clopidogrel, it may be a combination drug, diesterases, etc. The other set of group is the anticoagulants. Your anticoagulants such as warfarin, heparin, vitamin K antagonists, they affect the third phase. Usually patients are on either one or two antiplatelet therapy, but in certain more complicated or challenging cases, they may be on both antiplatelet and anticoagulant therapy. Not only are patients on these allopathic medicines, but they may be taking certain alternative medicine routes such as green tea, ginger, turmeric, celery, ginseng, licorice, etc. They may have habit of tea, so even tannin. All these alternative medicines also cause blood thinning. Now what happens when you go for a dental treatment? In processes such as diagnosis, in processes such as root canal therapy, in processes such as cleaning, the amount of blood loss or fillings, the amount of blood loss is going to be very minimal. The damage to the tissue is also going to be very minimal. In these kind of cases, which are classified as low risk groups, usually we do not alter or stop any medications. But in cases where we go for full mouth rehabilitations, in cases we go for gingival scaling, in cases we go for dental implants, in cases we go for full mouth restorations and root canal therapies, these patients have a slightly higher risk and hence they are classified under medium group. For these particular group, who are undergoing full mouth rehabilitations, we usually prefer scheduling the appointments in the morning. A triple antiplatelet anticoagulant therapy would be converted into a double antiplatelet anticoagulant therapy. If a patient is on warfarin, we usually shift them to a low molecular weight heparin such as Clexane for the duration of that treatment. So 3 days prior to the treatment and then 2 days after the treatment. Nowadays, most often we do not stop any of the medications such as ecospirin or clopidogrel. If we are very concerned, we may also get a blood report done of PT, APTT and INR. This INR ratio, if it is less than 3, then we are safe to proceed for the treatment. Now in certain high-risk groups, those high-risk groups would be a patient who has undergone a cardiac procedure such as stent placement or angioplasty or a bypass surgery or a valve replacement. These cases, we defer the treatment by 6 months. These patients who cannot stop medications but at a high-risk group, we need to take a cardiac fitness. We usually shift the medications from clopidogrel ecospirin to just ecospirin, from warfarin to a low molecular weight heparin. We get the blood work done such as CBC and PT-INRs. These ratios should be maintained below 3. Once this level is below 3, we can safely proceed for the treatment. These high-risk individual treatments would be a full mouth gum surgery, a flap implant. Hence at Royal Dental Clinics, we prefer using the 3D printed and 3D guides by doing a flapless procedure, whereby converting a high-risk individual treatment group into a medium or a low-risk treatment group. Now say we have taken all the precautions, yet in the treatment we find that there is excessive blood loss which is not stopping. So what are the different alternates we have as an operator, as a surgeon to do? So the best and the first step to go ahead is to apply pressure for at least 20 minutes. Most often the bleeding gets controlled. If even after 20 minutes we see that the bleeding is not getting under control, then there are other methods we use. Such methods would be applying a gauze dressing, using Abgel or oxidized cellulose gels, using of sutures, using electrocautery. The other alternates of stopping the bleeding would be using an adrenaline-soaked gauze for vasoconstriction, giving injection tranexamic acid or ethimstate, or a tablet pause. All these, they increase the coagulation activity of the body. Most often than not, these medications are adequate if we have to maintain the hemostasis in that region. Hence, it is very important that as a dental surgeon, as a maxillofacial surgeon, as a practicing doctor in private practice, we have all these medications available and we are adequately equipped to use these medications when the need arises. Bleeding, hemorrhage are rare in dental procedures, but when they do happen, you should be very well equipped with this particular set of instrumentations. Thank you.